Beth Israel Deaconess Hospital, Milton. Saving lives,
I really believe he saved his life.
changing lives,
A new lease on life, no question about it.
welcoming lives.
I didn't have to worry.
To get the call, it was scary. It was scary.
At his wife Gail's urging, Paul Morin came to Beth Israel Deaconess Hospital, Milton for a routine screening colonoscopy.
Giving someone the diagnosis of cancer is not easy.
Dr. George Barrett, a veteran gastroenterologist, believed he caught Paul's cancer early but wanted to take no chances. He recommended surgery.
I try to put patients at ease and let them understand the situation and give them time to think it through.
When we went to see Dr. Barrett, he made us feel very calm.
Yet the fear in this close-knit family, 2 grown daughters, 4 grandkids, was real.
I wasn't really scared of the cancer. I was scared to be in the hospital.
He was afraid of going in the hospital. I was afraid of, this is cancer.
Post-surgery, the surgeon delivered news the Morins still savor. The cancer was gone.
He also had told me I was very lucky because I guess Dr. Barrett has a history of kind of going in further, and where they found the cancer was, I guess, quite far in.
Gail and Paul remained connected to Dr. Barrett, grateful for his compassion and skill.
I really believe he saved his life. I really, really do.
Paul has returned to the hospital 2 more times to have both knees replaced by orthopedic surgeon Dr. Michael Berry.
People said to me, well, you can, go into Boston and get a specialist, and why would I go into Boston?
At BID Milton, the Morins found what matters most: people who care you can trust.
It doesn't matter how big the hospital is. I think the care is the most important thing.
In their 7 years of marriage, Brian and Jen Connor have shared both a life and a challenge.
We definitely gained weight together.
So much weight, Jen developed high blood pressure and symptoms of type 2 diabetes, a disease that was already taking its toll on Brian.
I was on, I think, almost every oral medication possible. My doctor said the next step was going to be insulin.
The Connors were referred to the weight loss surgery program at Beth Israel Deaconess Hospital, Milton. Here, the weight loss team, experts not only in surgery, but also primary care, mental health, and nutrition, evaluate each patient first as a person.
We just knew we were in good hands the whole time, to help guide us, to support us, and ultimately do the surgery.
The Connor surgeon, Dr. Benjamin Schneider, trained at the University of Iowa, where weight loss surgery was pioneered.
What really appealed to me from a patient standpoint is you have the opportunity to affect or change people's lives long term.
For the Connors, the changes have been dramatic. Brian lost 65 pounds, Jen dropped 95 pounds. They're both healthier, happier.
It's definitely a great feeling, and getting into clothes that I haven't worn in years.
As for Brian's diabetes, his doctor had welcome news.
She said, "My friend, you're officially cured."
The Connors continue to receive guidance and support.
We follow patients lifelong. I know about their children that they've had since surgery, trips that they've taken. These are things that they look forward to and have done, but that they wouldn't have done before they had the operation and lost weight.
Jen and Brian have also gained something: a new lease on life and gratitude for life-changing care.
The staff is amazing, and if anyone is thinking about it, they should definitely come in.
I just can't thank them enough for what they've done for us.
Baby Ethan, perfect, healthy, unexpected.
It was a big surprise because we were not expecting another baby.
Ethan has 4 big brothers. The youngest is 10.
All of a sudden, we're gonna go back to square one.
This time, Maggie Laurent was worried.
My biggest thing was because of my age. I'm over 35, so I know they consider anybody over 35 is a high-risk pregnancy.
Maggie found the care she needed at Beth Israel Deaconess Hospital, Milton.
How are you?
Where Dr. Alice Shin leads the outpatient obstetrics and gynecology program.
visits. It's just such a small office, so we could really follow up from one visit to the next.
Dr. Shin sees patients for routine checkups in Milton, delivers their babies at Beth Israel Deaconess Medical Center in Boston,
where I know that they're going to get the best care possible.
Her patients can also access BIDMC specialists, as Maggie did.
At the end of the pregnancy, where the baby was very unstable, position-wise,
Dr. Shin sent her for weekly visits to a maternal fetal medicine specialist at Beth Israel Deaconess Medical Center.
I felt like, I was part of a family that everybody was very good taking care of me and explain everything and every question that I had.
BID Milton offers moms-to-be the best of both worlds. The intimacy of a community hospital, including a weekly support group for new moms and babies, and the resources of a world-renowned medical center.
It's nice to know that when I do have a complicated patient, that I have some of the best specialists in the world backing me up.
Because all families want what Maggie and Ethan received, the best care possible.
I think, Dr. Shin takes very, very good care of us. I am lucky. We are very lucky.
Saving lives, changing lives, welcoming lives, making lives better. Beth Israel Deaconess Hospital, Milton.